I am here today to talk with you about bullying. This is probably a really common topic you see with your patients that are coming in. We're going to learn a little bit today about the state of the research, what we know about bullying, what kinds of effects it has on our youth population, and then we're going to talk a little bit about what you can do in your role with your patients in terms of prevention, screening, and treatment. So we're just going to dive right in here, and hopefully you learn something. All right, so there used to be not a lot of clarification in terms of what bullying is and a unified definition. After Columbine in 1999, there was a lot of it more attention and focus around bullying and trying to operationally define it so that we can do a lot more research and really understand this problem to be able to help our youth and maybe work towards reducing bullying. Unfortunately, we haven't seen that there's been a big reduction in bullying since we first started researching and collecting data. But there are a lot more programs out there now and a lot more awareness. And we're going to talk a little bit in later slides what that looks like. But in 2016, the CDC really clarified a definition for bullying that we use, and that's most common in the research. So we have three key elements here, three ingredients. First of all, this is behavior that is repetitive. So it's not just a one-time off occurrence. That doesn't mean that a one-time off occurrence can't be hurtful or damaging, but it's not really meeting that criteria of bullying. So what we're looking for here is a longitudinal type of behavior that's occurring over time, and that with the next one, there's a power imbalance. So that can be not only a true power imbalance, such as different sizes of kids, so if there's a child who's bigger than another, kids who are older than another, but it could also be a perceived power imbalance. So that could be things like that one child seems to have more resources or social status or some kind of power over the other child in some way. So that it's more of like a perceived power imbalance, not necessarily just kind of the obvious things that we know and can see. So even kids who are the same age, who are even friends, it still could potentially meet criteria for bullying depending on if there's that perceived power imbalance. And then lastly, intentionality. So this is not behaviors that were a miscommunication or interpreted, one kid interpreted it differently from the other, but this is really about like choosing to be hurtful, choosing to be mean-spirited, and that's where we get our definition here of bullying. So I just wanted to point out here, and I'm going to do my best today in this presentation to remember this and be mindful around how we talk about bullying. So I encourage everybody to really focus on the behavior and not labeling kids, because when we label the kid, it doesn't take into account the various factors that go into bullying relationships, including the environment, the dynamics at play, the fact that sometimes kids can be on both sides of this, so they can be getting bullied, but they could also themselves act as a bully themselves. So because of all of that and the fact that we want to encourage and elicit change, we don't want to label the child as a bully or a victim, but instead focusing on the behavior. So I've been practicing and making sure that I've been more mindful of this, and I encourage you to all do the same. So what does it look like out there? What's the landscape? As you can see here on this chart, the peak prevalence for bullying is in about 6th grade. So that's where the majority of this kind of behavior is happening. But what I'd also point out is these are things that we can hear even as young as preschool. And so some of these dynamics start very, very young. And by kindergarten, about 14% of kids are they're getting bullied at that time. And then it raises in about 6th grade to, I think, about 30%, and then tapering off in high school to about like 20 to 25%. Unfortunately, if you look at the research, the rates of bullying are really, really variable depending on how the data was collected, what kind of surveys they used. Was it a random sample of kids where a researcher came in and queried them, or was it a school-based survey that everybody gets? So the rates really vary. In one meta-analysis from about 80 studies, the rates for bullying were anywhere between 35 to 50%. In other studies, they found rates of as much as 50%. So it really varies across.
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.